Real quick, it seems obvious, and you highlight it in your digital reports. I mean, are there categories that you're excited to see come forward post COVID? Healthcare categories, or at least generally healthcare technologies that you're excited to see come forward after COVID?
Yeah, I'm really excited about some of the growth in the market overall post COVID. So in particular, remote patient monitoring, it's one of those areas that's been around for a long time. Like I remember back in 2016, I met with a ton of companies in this realm, but in reality, it just never really got much traction in the past. But I'm seeing more recently that these are companies that are really what's needed in the post-COVID world, like empowering patients at home. Because one of the key issues with telehealth is that there's no way to like measure vitals, and vitals are critical for any sort of like true care experience. Like you can do a telehealth visit, but if I can't tell what your blood pressure is, or I can't tell what your like your blood oxygen level is, or whatnot, like it's kind of like I just ask you some questions and you give me a feeler of it. But like RPM solutions that can enable and empower telehealth are definitely going to be an area for growth. And we're already seeing that, and that's specific to certain populations as well. So it's not like every single person in the country needs a blood pressure monitor at home, but if you're part of an ACO, or you're part of like like a medical group, or whatnot, like something like that would be essential for providing care in home and reducing costs and reducing the burden on both the patients and the providers. And so I see that space is growing. The second area is an area I hit on very briefly, which is AI solutions focused on telehealth. When you have telehealth visits, you're essentially recording interactions between a provider and a patient in a way that just hasn't happened before, and in a volume that hasn't happened before. Like the level of data you can acquire through that is exceptional. And so I think AI solutions that could either fit on the back end, meaning help in digital scribing, help in providing information to patients after the fact, like those are going to be in high demand and going to be needed. Like what I envision one day is just like if I'm having a telehealth visit with a provider, that there's maybe like like a little bot on the side that tells me like something, or sends me a link to something. If the doctor says, hey, you have X condition, you should be eating these type of foods. Hey, here's a link to that type of food. Click on that and you can get it into the background. And similarly, just something along those lines where you could really do that now with the data that you're going to acquire with these telehealth visits. And then I think that the last thing is just like the expansion of like virtual clinics. And what I mean by that is just the fact that there are going to be more and more providers on the virtual care side. And we need to have tools that can help empower those providers more effectively and build deeper networks of specialty and primary care providers who can kind of fill in those needs. And that gets to that vision that I described around like that seamless 1 time or 1 hour type experience where talk to a primary care provider, they refer you directly to the specialist gives you what you need, and then you get your care at a pharmacy, or you get your care after, maybe even delivered to your house. Like, and so that type of seamless type of experience requires like networks of providers and significant networks of providers. And again, that kind of goes into previous points around cross-state licensure and all these other things. But I think that's kind of another area that I'm excited to see some growth in.